Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
There's also been an announcement on long COVID.
Yes, 4 major studies into the long-term effects of coronavirus, or long COVID, are to take place with £18.5 million of government funding. Now, they're going to look at the cause, symptoms and effects of long COVID, the impact also on children, and why some people develop it and others don't. You know, it is a debilitating condition for some people and is yet another of the many mysteries of this virus.
Victoria McDonald.
That government announcement for research funding could not come soon enough for those already suffering from the long-term effects of the virus. About 1 in 10 people with COVID continue to experience symptoms after 12 weeks. There are some who have been experiencing symptoms for almost a year, many unable to work, others, even children, having to use a wheelchair. We've been out to meet families, wondering when and if they or their loved ones will ever get better.
Can you have the blanket, please? Right. Well, my favourite sports are like football and rugby. I used to play rugby on a Sunday and football on a Saturday.
It's been really difficult to see him not able to go, not able to do it, and to not know when he might be able to do it again.
The first time I used a wheelchair it was really uncomfortable. And I just thought, like, oh, when will I be able to walk again?
It's been like going back to having a baby again. That's how it's felt, because he hasn't been able to do anything for himself.
I've just been in agony. Obviously, it started with a really, really bad cough, and then it just progressed on, got worse and worse, and it just started with this immense pain in my shoulder, and then went on to just be my whole body, and it just overtook me, and it was excruciating.
The hardest thing I've ever had to hear, to hear your little boy say, "I don't want to live anymore because I'm just in so much pain and I can't do anything, I can't move, I can't get out of bed. There's no point." And it was just absolutely terrifying to hear that.
Some days it's better than others, isn't it? I think the worst part is when you have a shower and things, I've got to be there in case you fall, and then you can't have baths because it just makes you more dizzy. Dean's had long COVID since January, February time, so about a year now. Your hat and your coat's there, darling. Living with someone with long COVID, it's quite hard sometimes. He's got the symptoms constantly of feeling dizzy, feeling tired,
good girl,
nauseous sometimes. He just gets frustrated, he just wants to get well, he just wants to be normal. I mean, he's only 30.
I'm currently not working, so the job I did before I got long COVID was support worker for adults with learning disabilities. I used to take them out places and help them with their independence. I am waiting to go back to work, hopefully I can go back to work. I've got another member request as well, I've just approved in.
So Dean set up the long COVID group a few months back, partly because, well, I suggested he needed something to focus on to help him and help others.
I've got a live Q&A for Dr. Heitman.
Oh, cool.
So I'm going to do a post and see if they have any questions they'd like to ask.
Hi, Dean. Can you see me?
Yeah, I can see
Brilliant.
you. Yeah.
And you are with someone important who is...
Girlfriend, we rock.
Everyone needs a rock. Nice to meet you. Do you want to start off with some of the questions that the group have gathered for me, and I'll do my best to answer them from what we know at the moment?
Yeah, I've suffered for a year. Even now when I'm speaking, it's extremely difficult, you know, and I'm extremely dizzy and lightheaded, you know, it's awful. Am I going to be like this for the rest of my life?
I think you're going to see some improvement. I had quite a lot of patients that got better at that 9-month moment. I think the thing that's less clear is whether you could still have a relapse.
Now, obviously there's vaccines out there, and I think you'd expect this question. Is it safe for us to take it?
We know that COVID as an infection's had a serious effect on you, and if there were any risk of you getting COVID again in the future, that could be more dangerous for you than another person, and therefore I think having the vaccination is a good idea.
No, I'm not. 3, 4, 5, 6.
What long COVID is?
So what is long COVID?
Yeah.
So, you know, Daddy has problems breathing. Doing my... And then I can't move about too much and I can't play football. So long COVID means that I am sick a lot and I have to rest an awful lot because COVID has made me really, really poorly. But I'll get better. I'll get better one day. A year ago, I was training hard for a charity boxing match in December. Within 7 months of me catching COVID, I had a pacemaker. Everything crashed.
It wants to go.
No way. Let me see that properly. How's that? The attention is with COVID. Stopping things from dying. The attention isn't with long COVID. It's not even acknowledged in the mainstream. So people aren't aware of it in the mainstream because it's not being spoken about in the same way that COVID is spoken about.
Every morning I have to take the turmeric with black pepper for information, so they're about £12. £12 a bottle of them, and then I have my vitamin D and my iron tablets and my cod liver oil. I've spent around about £1,500 to £2,000 trying to make myself well. Unfortunately, you read all the time there's people that are 10, 11 months and they are completely bedbound still. That's where I was at the beginning. March, April, May, I was completely bedbound, I couldn't walk. People are clutching at an answer, any answer, to feel normal again. We haven't got any care, we haven't got any answers, I haven't got anything. So it's hard to move forward when you have no idea what's wrong with you or how to help yourself.
3 times a day he has a pot of different medication, and he's got more to come because they're being reviewed at the moment.
Morning, happy birthday.
Oh my God!
It's scary as a parent to watch, to think, you know, are they ever going to get back to normal? Manny hasn't been in school other than 8 days this academic year. It could have a knock-on effect for the rest of their lives, and I'm really dearly hoping it doesn't, but we don't know. It needs to be investigated, and we need answers for them, because it's not fair for children to be left suffering in this way.
Well, earlier I spoke to Dr. Natalie McDermott, who is a paediatrics infectious diseases expert at King's College London. At the start of the pandemic, she was regularly on this programme, helping us to understand it. She caught the virus and has now been diagnosed with long COVID. She had been fit and healthy, working long shifts as a doctor on the wards. Now she can only walk perhaps a few hundred metres without stopping.
Yes, so I believe I contracted COVID the first time at the end of March while I was at work, and then I recovered from that episode, but then at the end of May I believe I contracted it again whilst working on the wards, and following that episode I didn't fully recover and I developed nerve pain in my feet and difficulty walking, and things have sort of gradually progressed from there.
Have you been able to work out whether you need to have had an attack first and then you develop long COVID later, or is there no relationship between the two?
Well, some people seem to have an episode of acute COVID and then recover and possibly have a relapse later on, not necessarily a reinfection of COVID, but for some reason they develop all the symptoms of long COVID. But then there are other people who have their acute episode of COVID and never fully recover from that, and go on to have recurrent sort of improvements and relapses with different symptoms of long COVID.
Well, the government's announced, 18 million to go towards the both the research and the treatment of long COVID. Is that taking you anywhere?
The studies that have been funded are predominantly looking at the epidemiology of COVID and what the picture of long COVID is and how common it is, and in a similar manner to what we've done with people who are hospitalised with COVID, we need some clinical trials to include people with long COVID and see what kind of treatments might be beneficial for them.
In our film tonight, which really looks at both children and adults, the children in particular seem to be really very, very badly affected.
We do need more attention brought to this situation, because I think a lot of children are not being taken seriously when they present to hospital with these symptoms, because there's quite an array of different symptoms, and the medical profession don't fully understand exactly how they all fit together. So sometimes they're dismissed as being anxious, or their parents as being anxious. And I think it's important that we draw attention to the fact that long COVID does affect children as well, and they need to be taken seriously when they seek medical attention.
And is the medical assumption that you do recover from long COVID?
What we're observing at the moment is that, yes, most people seem to recover from long COVID, but it's a varying amount of time. So I think from the ONS data, we see that approximately 20% of people who've had COVID will have some degree of symptoms still after 5 weeks, but then 10% will still have symptoms after 12 weeks. So clearly a lot of people do recover in that 12-week period, but then we have other people who go on to have symptoms that last a very long time, and it's unclear why their symptoms are not abating.
When it comes to the government's response to all this, do you think that they're taking this seriously enough? I mean, should you not be compensated for danger work?
Well, certainly I think that it is time that the government recognised the impact of acute COVID, and also then the development of long COVID on frontline workers, and particularly healthcare workers, because these are the people we've been relying on to be on the front line and to look after people. And so I think now that they are unwell, we need to look after them as well. And while there is certainly sick pay for people with long COVID, at least in terms of healthcare workers, there is a point at which that will come to an end. So I think it's really important that anyone who has been made unwell by doing their job, that long COVID then is recognised as an occupational disease, and people are adequately compensated if they're unable to return to work.
Dr. Natalie McDermott.